Hi, welcome to this unique
Hi.
hairstyle initiative by IPCA. I'm Mona Sharma, and it's my pleasure to be your host today. This unique initiative seeks to provide expert advice for various issues connected with hair care. Our hair is a crowning glory and it makes a world of difference to our appearance. However, our hair also requires special care and attention. Earlier, hair problem was associated with the middle age when you used to lose hair or have thinning of hair or bald patchy hair. However, with increasing pollution and the increase of stress in our daily work life, we are now seeing hair problems occurring even at a younger age. It is not uncommon now to see 25 to 35 years old people having hair problems. Most of these problems, if identified early, can be managed well, and much of the hair loss can be avoided and can be fixed by managing to modify our faulty lifestyle. Today, we have with us Dr. Hitesh Khatri. He's MBBS, MD in Dermatology, Venereology, and Leprosy, Fellowship in Dermatosurgery and Laser. He's ex-senior resident at Sion Hospital, Mumbai. He has been practicing medicine for over many years now and is known for his exceptional medical expertise. He's currently practicing as consultant dermatologist at Mirari Clinics, Amravati. Dr. Hitesh Khatri has dedicated his career to diagnosing and treating a wide range of skin and hair conditions while providing personalized healthcare services to his patient. He takes time to listen to his patient concern and work closely with them to develop a treatment plan that meets their individual requirement. Dr. Hitesh Khatri is aware of the need for the patient awareness and education about hair care and spend a lot of time in giving talks at various platforms across the country. Thank you, Dr. Hitesh Khatri, for sparing your valuable time to answer a few questions on hair care for us today. Welcome to the show.
My pleasure.
डॉक्टर हमारे साथ जुड़ने के लिए बहुत बहुत शुक्रिया.
Thank you so much, ma'am, for inviting me.
So, doctor, today we are going to discuss the hair care in current scenario. So, when we talk about hair care, the first questions which come up to our mind is the most common problem, which is now facing by all of us, is hair loss. So, doctor, what's normal and when to be concerned for?
So, if you are losing 50 to 100 hairs a day, it's considered to be a normal thing. But if you are losing more than 100 hair strands a day, then it becomes an abnormal thing and you should immediately consult your dermatologist for the same. But if you are losing around 70 to 80 hairs for a prolonged period of time, like 2 to 3 months, so then also it's a cause of concern and you should consult your dermatologist ASAP.
Okay, so like 100 to 150 hair loss is normal, but over than that, you need to.
50 to 100 is normal, but like if you are losing more than 100, then you should immediately consult your dermatologist and get yourself evaluated.
Okay. Okay. So, doctor, what are the general causes of hair loss?
Now, hair loss is a multifactorial thing. So there are range of causes which can lead to hair fall. First, like the most commonest one is the androgen mediated. Like if your body produces excesses of male hormones, so your hair follicles become sensitive to that and you develop pattern hair loss, like male pattern or female pattern hair loss. In addition to that, lifestyle factors such as stress, inadequate diet, inadequate exercises can also lead to hair falls. Furthermore, other causes like autoimmune conditions, inflammatory causes like systemic lupus erythematosus, connective tissue diseases, these can also precipitate hair loss. In addition to that, other causes such as autoimmune causes such as alopecia areata, in which you can see the patchy hair loss over your scalp. So these are also some of the important causes of your hair loss. And nowadays, stress and pollution are also emerging as one of the prominent causes of the hair loss. So you should get yourself evaluated accordingly.
Okay. So, doctor, like when we are talking about causes, nowadays we are all like you said about the lifestyle. So nowadays we are all
Yeah.
facing a bad lifestyle, like working late nights and not having any sleep. Or so, what does can you just enlighten us more about lifestyle? How does the lifestyle play a role in a hair loss?
So lifestyle factors like that, if you are not taking proper sleep, so your hormonal imbalance occurs and the oxidative changes begin to occur, which can lead to increase in your hair fall. Also, another lifestyle changes like many people are resorting to junk foods these days. So there is a depreciation of the micronutrients in the body. So because of these micronutrients, which are important components of the amino acids which form your hairs and hair shafts, so these can lead to increased hair fall. So in such manner, lifestyle factors can contribute to your hair loss.
Okay, so lifestyle does play a vital role in hair loss.
Absolutely,
We should try to
absolutely.
follow a healthy lifestyle. So, doctor, like
Yeah.
when we are talking about causes and hair loss, so is there any like what are the medical treatment options for hair loss? Is there any surgical, topical, or non-surgical, or is there any oral also we can eat and get the hair loss problem solved?
So first of all, we need to evaluate the exact reason for your hair loss. So if you are suffering from like systemic problems which are causing the hair loss, so you should get treated for that things. In addition to that, the lifestyle factors which are in addition to that causing your hair fall, you should correct all of that factors. You should eat a balanced diet for the same. So now after that comes your proper medication part. So medication can be used in the form of a topically application or oral formulation. So topically you can apply minoxidil, finasteride, dutasteride solution, and in addition to that you can use saw palmetto extract, redensyl capixyl based solutions. So coming towards the oral therapy, so orally we can use finasteride, dutasteride for the same. Also, if some persons are non-responsive to the minoxidil in the topical form, we can try the low-dose oral minoxidil therapy for them also. So, if the patient has advanced rate of hair loss, so hair transplantation surgery can also be undertaken for the same.
Okay, so lot of treatment options are available. We can
Absolutely.
yes, we can go to the doctor and get according to the hair condition problem, we can get the problem solved. So, doctor,
Yeah.
like we are talking about treatment, one word called nutraceutical is getting a lot of focus nowadays. So, what is this
Yeah.
nutraceutical and what is the role of nutraceuticals in our hair health?
So nutraceutical consists of multiple amounts of the trace elements which are important and essential for your hair growth. Now, due to the unhealthy lifestyle or inadequate dietary intake, you get a deficiency of a lot of these nutrients. So these hamper your hair growth. So nutraceuticals contain many of your vitamins and minerals and essential amino acids in the proper requirement as per the recommended RDA. So these can aid in the nutritional management of the hair loss. So if you're suffering from any nutritional deficiency, these nutraceuticals play a vital role in that.
Okay, okay. So, doctor, which are some of the herbal or like plant extract or phyto constituent used in management of this hair loss, like alopecia?
So nowadays the world is shifting towards like we want everything organic and natural. So we can also try some of the extracts like saw palmetto extract has a natural antioxidative properties and it can inhibit the testosterone synthesis in the locally scalp area. So this can be beneficial. In addition to that, grapeseed extract, ginseng extracts are also beneficial. You can also try some of the which are known since many years, like ashwagandha has also been known to promote the hair growth.
Okay, so many like different varieties of nutraceuticals are available, which help in hair loss. So, doctor, when we are
Precisely.
talking about these nutraceutical or nutrients, there is a word called micro and macronutrients. So, what's the role of these? What is micro macronutrients, and what's the role of this micronutrients in hair health?
So micronutrients are basically the trace elements which are required in a very small quantity as compared to the macronutrients. So your macronutrients are like iron, vitamin D, like that. So micronutrients, it includes like selenium, copper, magnesium. These are the zinc. See, these are the basically the trace elements which are required for your hair growth. So, selenium is an important cofactor for many amino acids, and it is an important part of the glutathione also, which provides antioxidant action. And magnesium and copper are also an important part of the peptides, which can help you regain the your hair grow back. So these trace elements, although these are trace in nature, but they leave a big impact on your hairs.
Okay. Okay. So even micronutrients are also essential for the good hair
Yeah,
health.
absolutely. Yeah,
Okay. So is it required to take these nutrient as per gender RDA requirement, or we can just take it blindly? Like there are a lot of Insta, grams which are telling take this and take that to have a good hair health. So is it like required to take this as per RDA requirement?
absolutely. It's absolutely essential to take as per your recommended dietary requirements, because if you don't take according to that, even hypervitaminosis can lead to hair fall. Like if you are taking excesses of vitamin A, vitamin D, it can also further lead to increase in your hair fall. You can also suffer from brittle nails or skin rashes. So it's very prudent that you should take this micronutrients in the moderation.
Okay. So, okay, so it is very essential to take them as per gender RDA requirement. And
Absolutely.
okay, so doctor, when we are talking about nutrition and hair loss, so another problem which is very common is dandruff. So does dandruff play any role in hair fall, or does it cause hair fall, and how should we manage it?
So dandruff, actually, to the layman public, dandruff appears like a dandruff, but to dermatologists, dandruff can be a gateway to the multiple causes. Like dandruff can be an inflamed seborrheic condition of your scalp, or you may be suffering from the scalp psoriasis per se. So, like in majority of the cases, there is not an increased hair fall with all of these conditions, but sometimes it causes an apparent increase in the hair loss, because the hairs which are loose in your scalp get shedded while doing shampooing repeatedly for the dandruff. So it appears that you're losing more hairs, but it's not like that. So dandruff does not play a role in the increase of the hair loss. So yeah, but you get yourself treated for the same, because if you are seeing the excessive hair loss because of the dandruff, so you may tend to get worried for the same.
Yes, yes, very true, doctor. Very informative, doctor. So, like when we are talking about dandruff and the stress is another problem. So, when we are at home, does this due to long working hours and not sleeping, not eating, so there is any impact of stress on our hair health?
So stress can be due to the physical factors as well as mental factors. So due to the physical factor, if your body is subjected to stress, like someone is on a crash diet, you're depriving your body of the micronutrients and everything. So that is also a form of stress. So that we have already discussed can lead to increase in the hair fall. So in addition to that mental stress, like if somebody is worrying constantly, so it alters the chemical balance of your body, and it can lead to the oxidative damage if somebody is not getting proper sleep and is constantly stressing. So like the body goes on a spree uh, to destroy or to reduce the hair follicles and everything by the oxidative manage, and all the antioxidative therapies take a backseat for the same. So yeah, stress plays a big role in your hair loss.
Okay, so we need required to manage the stress. So, doctor, like you're talking about stress
Okay.
and you're at home, because nowadays a lot of people are working from home. So, whenever we feel stress, our mother tell us to like massage your head or put oil, and you'll get relaxed. And it is also good for your hair, for a long hair and shiny hair. So, oiling hair is a ban or a boom? Can you please enlighten us on this.
So first thing, the second thing that you said that oiling of hairs can lead to shining of your hairs. Okay, that is absolutely correct. So oiling has a role in the shininess of your hairs, so that the ends of your hairs are properly sealed and you get the proper shine for that. But as far as the hair growth is concerned, so no, oiling does not play any role in the hair growth. But yeah, it can give you a shiny, lusterful hair. But
Mhm.
if you are suffering from dandruff, you should avoid hair oil because oiling can aggravate the dandruff. And then again, this vicious cycle goes on.
Hmm. Okay. So, like Doctor, like even it is said that itna matlab deep tak lagao. So, what's the right way if someone wants to put the oil to their hair? So, like scalp tak lagao ya hair shaft tak laga lo, theek hai. Like, what's the? I mean, because there are a lot of myth about it. Yeah.
So, like I previously said to you, oiling is mainly for the hair shaft. Okay, so
Okay.
there is no role for the oil to be applied on the scalp because our scalp already contains many oil producing glands and they are producing the oil in the adequate manner. So you do not need oil for that. So if you are have dry, frizzy hairs, definitely oiling will help you a lot. So oil should always be applied over your hair strands,
Mm-hmm.
not over your scalp.
Scalp need to be avoided. Okay. So,
Yeah,
doctor,
precisely.
okay, thank you so much, doctor. So, doctor, like, can you just give some important tips for healthy hair?
So for there are few tips which needs to be followed if you want a shiny, lusterful hair. So first of all, keep your lifestyle in check. So you should get a proper uninterrupted 7 to 8 hours sleep every day. And the stresses, whether it should be physical or mental stresses, they should be avoided. And in addition to that, if you are suffering from any systemic illnesses, you should get yourself checked for the same. So, like you should not comb your hairs when they are wet because when they are wet, they are very fragile and it can lead to breakage of your hair shaft. So, if you so in addition to that, you should not use like curling or styling products over your hairs because it cause the breakage in your hair shaft and hair bonds for the same because it further leads to increase in your hair loss. So if you want to use the hair styling products, so what you should do is that you should apply a heat protective spray and you should use at the minimum possible setting.
Mhm.
In addition to that, if you are using a blow dryer for your hairs, so you should keep it at a maximum distance of minimum distance of 15 to 30 centimeter and the heat part should not be there. So these are some of the important tips. Like if you have like split ends, you should cut your hairs like at least 1 inch so that the split ends tend to get repaired for the same. And nowadays, many things are going on like we should use sulfate-free shampoo. So like, okay, sulfate-free shampoos are good, but sulfate-free shampoos are not for everyone. So if someone has an oily scalp and if or he she's using sulfate-free shampoo, the scalp would not get cleansed. For
Mhm.
cleansing, sulfates are absolutely essential. So because of this reason, sulfates should be used, but in moderation. But if you are suffering from a dry, frizzy hairs, you should probably avoid the sulfates. And lastly, don't forget to condition your hairs after the shampoo.
Okay. Okay, that's very interesting, doctor. That even sulfate shampoo can be used for some people, because
Yeah.
nowadays that was very like informative for us. So, doctor, this discussion was very informative, and I'm sure our viewers would be benefited by it. So, doctor, can we take some questions from our live audience, please?
Yeah, sure thing.
Yeah. So. Um, the first question by our live audience is, do people with dry scalp are more prone to dandruff?
So dry scalp and dandruff, these are two different entities. Okay, so dry scalp can also cause flaking and itching. So that needs to be differentiated from the dandruff, which can be a part of the seborrheic dermatitis. So you should get yourself checked from the dermatologist for the same.
Okay. Uh, another question is, डॉक्टर मैंने सुना है कैस्टर ऑयल बहुत अच्छा है बालों के लिए, तो कैस्टर ऑयल कैन मेक माय हेयर ग्रो फास्टर?
Again, the hair oil has no effect on the hair growth. For shining, probably you can use it, but I think coconut oil is the best for the same.
Okay, so for shining you can apply, but for hair growth it is not good. Okay, another
Yeah. Again,
doctor.
if you're suffering from dandruff, it's a probably no. Oil is a proper no if you're suffering from dandruff.
Yes. Moving to our next question of our audiences, डॉक्टर आपने कहा स्ट्रेस मेरी मेरी लाइफ में बहुत स्ट्रेस है और मेरे ग्रे हेयर हो रहे, डज स्ट्रेस कॉज ग्रे हेयर?
Actually, graying of hairs, or as we call it in a scientific term, known as caninitis, it is due to a range of causes. It could be due to micronutrient deficiency. It could be due to the physical stress. Like if you're starving your body, that is also one kind of stress. So yes, it can lead to premature caninitis, and some systemic diseases can also lead to premature graying of hair. So first you need to decide that at what age you are experiencing graying of hairs. So as for the Indian population, if you are above 5 years of age, so then it's not a premature caninitis, then it's a normal condition.
Okay, very informative, doctor. Moving to our next question of our audiences, does shaving or trimming hair make it grow back thicker?
So like whenever we are shaving, so like if your hairs are like that and you cut it via shave, so it's cut at an angle. So like when it grows, the angulated part is the most outer part of the hair. So there is a visible appearance of a thicker hair, but it is not like that.
Okay, interesting. Uh, this question is very interesting from our audience. Doctor, आपने कहा crash diet मत करो. Does fasting can cause hair fall? I do fastings.
So fasting you can do, but you should get a proper nutrient in between that. So if somebody is doing intermittent fasting, okay, all right. But up till when you are getting your all the micronutrients in the recommended dietary allowance, so you're good to go. So like fasting and dieting should be done with a scientific approach.
Okay, so scientific approach is very important, just not blindly following any diet. Okay.
Yeah.
Another question by our audience is, does shampoo really help hair get the nutrient requirement?
So basically, the role of the shampoo is cleansing your scalp only. Now, some of the shampoos that have come up in the market which contain ingredients like caffeine and which can help volumize the hair. So, okay, shampoo can help in volumizing the hair. It can cause increased perception of like that, but no, they cannot provide nutrients for that. The role of the shampoo is cleaning only.
Okay, very interesting, doctor. That it's only helping clinic, not the nutrient. Okay. Another interesting question is, I also want to know, is hair spa good for hair? It make my hair go faster?
So again, hair spa has no role for your hair growth. Nothing.
Okay. Okay, so it just for relax or just
Yeah,
shine.
yeah.
Okay, okay. Uh, another question is, डॉक्टर मुझे एलोपेशिया है और मैं बहुत टाइम से विटामिन्स टैबलेट खा रहा हूँ, तो क्या ये मुझे पूरी लाइफ लेनी पड़ेगी या मैं रुक सकता हूँ?
So first yourself, you need to get checked what kind of alopecia you have. Like if you have a pattern hair loss, like male pattern or female pattern, whether it's due to the androgen sensitivity or not. So, like if you are suffering from a micronutrient deficiency, so once your micronutrient deficiency gets corrected, you don't need to take for that further anymore. But if you are suffering from androgen sensitivity, like
Mhm.
in majority of the cases, so then you will have to continue the medications as long as you want hairs over your scalp.
Okay, okay. इंफॉर्मेटिव डॉक्टर अनदर क्वेश्चन डॉक्टर आपने कहा कि ग्रे हेयर प्रीमेच्योर एज के वजह से होता है मेरी बेटी के ग्रे हेयर है वो 8th क्लास में है तो क्या मैं ये रोक सकता हूँ
So you need to get evaluated. आपको ब्लड टेस्ट करानी पड़ेगी कि आपको कौन से न्यूट्रिएंट की कमी है. साथ ही साथ जो लाइफस्टाइल चीजें जो हम आज बातें कर रहे हैं उस चीज के बारे में, तो यू नीड टू डू द लाइफस्टाइल मॉडिफिकेशन फॉर दैट. Nowadays kids are also subjected to junk food, like they all want pizza, burgers and everything. Also, like some of the kids are awake till late night playing games on their phones. So, like, you need to do a holistic approach for the same. Like, you need to evaluate if they are usually the micronutrient deficiency is there. If we correct the micronutrient deficiency for the patients, usually the condition can be reversed.
Okay. So this can be reverse graying of hair for younger age kids.
If only if you are having a micronutrient deficiency or if there are lifestyle causes contributing to the same.
Okay, okay. Okay, interesting, doctor. Another question is by our audiences. I have been recently detected with thyroid disease, and even I'm facing hair fall. So, is it because of thyroid, or I should go and get something checked?
So thyroid is definitely, so first of all, what kind of thyroid you are having, whether it is a hypothyroidism or hyperthyroidism, because both the conditions can cause hair fall. And also the pattern of the hair loss varies according to that. You can develop patchy hair loss or you can develop a diffuse hair loss. So you should get yourself checked from a dermatologist, and probably if there is something association is there, he will definitely point out that.
Okay. Okay, interesting, doctor. As we are running out of time, I'll ask you another question, the last question from our audience. I work as in an IT company, and my sleeping hours is very bad. I sleep only for like 2-3 hours. So, can less sleep cause hair fall?
Absolutely, because sleeping goes makes your system go into haywire, and the constant when you are awake, so body tries to divert the nutrients and everything to help you keep awake. So also when you are awake for a longer period of time, you tend to binge on the junk food and everything. Also, like when you sleep for a lesser time, the melatonin hormone gets altered, and which is an important antioxidant. So yeah, sleep does play an important role for your hair loss.
Just a minute, doctor.
Yeah.
Yeah, hi, doctor. I think there is some technical issue with our host. So, sir, I think all the question she covered. So, with this, we thank you to joining us for this live show. And
Thank you.
yeah, thank you so much for your valuable time.
Yeah, thank you so much for
Thank,
inviting me. Thank you.
thank you, sir.